Hello. The political viewpoint article for the July 6th edition of the Canvey and Benfleet Times was written by Castle Point Labour's press officer, Mr. Joe Cooke. Joe's with me now to talk through the article and expand on some of the points he's made. Hello, Joe, and thank you for writing the article.
Yes, thanks, Mark, and thanks for the invitation, both for the article and for this session. I was chair of health and environment back in the last Labour session, Labour administration of Castle Point, which was from 1995 to 2003, and instrumental in setting up the primary care group and trust, etc. So therefore, clearly interested in health issues. And with mentors like the late Councillor Tony Wright and others, I followed on from them and as an elected public governor of the Southend Hospital Trust. This operates on the basis of a 3-year term. You can do a maximum of 2 3-year terms. So I did 6 years, and then because we had the pandemic, it stretched into a 7th year. So really, I'd done my bit, and wow. That's why I didn't continue with that. And that covered the time of the combining the 3 hospitals, which makes sense. I disliked intensely the kind of competition between hospitals, very similar to the competition between football clubs. That was totally necessary. What we needed was cooperation. But here, the point I'm making in the article is that despite all the fanfare of 10-year plans and financing, etc., the reality is the trusts had to comply with financial rules and regulations, which meant that unless the money was in their budget, they couldn't actually make the changes. And we had in Southend a £12 million cut savings to find, some of which were definitely affecting services. And that applied also to other trusts I went to, like the Mental Health Trust, or I think the EPUT, whatever it is. Similarly, I asked the question there, are these going to affect services, these savings in inverted commas? And yes, they are. And that's the thing. So until the money that's been spoken about in an excellent concept of a 10-year plan with plenty of financing, unless that's actually put up front, then nothing really changes. We aren't recruiting. There's no hospital beds shortage. There's a hospital nursing shortage. The beds are there. It's the nurses that we need. And the simple fact is we weren't in a good position for this pandemic, and that's a vital bit of information that we all ought to bear in mind.
If I'm not wrong, I heard that there was some sort of survey done in about 2016 that was a sort of pandemic preparedness test. They had everything in mind to do. Is it right that even with that, they didn't spend the money, so they weren't ready for it? Is that correct?
Well, that's true. And there's another bit of information as well, which I think is quite important, which relates to the fact that and this is, I can quote the author, etc., but basically with what we did with the public health, scrapping of the public health side of things and the funding for it, we effectively destroyed our ability to be in a position to respond to this pandemic. And then we're scrabbling around to actually work with things. And we already had, as I said, this shortage at one stage, 140,000 vacancies of clinicians and nurses, etc. We already had those shortages in place, and that's what the real difficulty is. But having said that, I mean, any organisation, any government hit with this pandemic, as we've got to have some sympathy for that. But we've got to also learn lessons. And that's what I'm saying in my report there. We can't ignore those lessons. We can't ignore the fact that the approach caused the problems, not just the pandemic itself, but the fact that, as you say, despite reviews, we were unprepared for it.
You go on to say that local council finances hollowed out, benefits transferred from national to local with insufficient funding. That's other areas of funding, other areas of support that you're talking about there. Is it separate to the hospital?
the Citizens Advice Bureau that I was involved with for some decades, that unfortunately has collapsed in Castle because of the lack of funding. That was operating on the basis that when we advocated benefits and made sure the benefits were being obtained for people, we could actually get income into Castle Point. We estimated that would be a minimum of £200,000 per year on the basis of helping those people get the benefits they deserved and needed. But when and Castle Point Council, of course, were pleased to see that income coming into the borough. But when the responsibility and financing shifted from national to local, and any kind of resources being used to supply those benefits came from the local council with insufficient funding to actually do that. And so the whole emphasis changed. Instead of actually trying to find people that needed the help, I'm not saying that they necessarily did change that, but clearly the incentive to find those people that meant more money coming into Castle Point had disappeared. And this, I think, was a deliberate move. But it's not just that. I mean, we've got the care homes, we've got the youth services that were decimated from, I think, 12 million a year to, in county terms, down to, or 15 million, I think, down to 2 million and even less than that. Lots and lots of cuts, which it must have been terrible to be of any political hue trying to run a council with those kind of cuts, which I would call hollowing out. And that prior to the pandemic. I mean, one of the worst things that I mentioned in there is the cutting of Sure Start. Now the evidence is absolutely clear that we must concentrate on children to avoid problems in later life, particularly with mental health. And Sure Start was the ideal for that. Scrapped, along with nursing bursaries and the like. This is just false economy as far as we're concerned, and that's why we want our vision to be better than that.
Can I get you to just outline what Sure Start was for anyone who doesn't know, please?
Thanks. Yes, my recollection of it is that what it basically did was, without any questioning of needs, whatever, people were able to bring their children preschool age to an incredible environment of learning and care that relieved parents of the caring mode and also gave the children the best start in life. And it took money and resources to do that to the standard that was required. And was absolutely welcomed, absolutely loved by most, and cut, just stopped basically by the as part of the cost savings of the government, which I personally believe is actually false economy.
Do you remember what year it was that closed down? It was a while ago, wasn't it?
It certainly was. Yeah, I think it was post. It was before the 2015 fully Tory government. I think it was done under that first 5 years after the 2010 coalition of Tory and Liberal. But even so, the fact is that there's no attempt been to restore that, and this is what we now are seeing through various reviews, is absolutely necessary that we have the child's preschool child and children generally welfare at heart, so as to ensure that we don't have problems in later life, because mental and physical health problems are linked so closely to what happens in early childhood.
Very interesting looking at the sort of knife crime and all that sort of stuff that's going on at the moment. The young people that seem to be involved, I guess 16, 17-year-olds, that sort of age. Is there a correlation, do you think?
I personally do. I mean, when we take away youth services and resources for the youth, and then witness what's happening in terms of how they rebel against that and say basically, okay, you don't care about us, etc. Then that's part of it. But I think also another key thing which I mentioned in there is the difference of approach that Labour would have to housing. I mean, I dread to think of what it must be like to be invented accommodation without any security of tenure, and the fact that we don't have anything like the kind of council housing stock that we used to have in Castlepoint, which was one of the smallest in the country anyway. And I think that kind of lack of security, so that you're not linked to your school or your resources generally, can't help youths. That must be dreadful. And a lot of us are comfortable in Castlepoint, the owner occupiers, with house prices going up, maybe mortgages paid off, but an awful lot need our care and consideration, and that's what we're thinking of. I mean, I just printed out the Labour's policy on housing, which admittedly is the 2019 one, but it's brilliant, absolutely brilliant in terms of how it's going to tackle land usage, council or social housing, true social housing, making sure that, as it puts it, local people have first dibs on the housing that's produced by that, rather than people coming in from London and downsizing and taking all that land here, presenting problems for the future. You'll notice, Mark, that I'm making the point which I made years ago at a Labour Party conference about the infrastructure. We definitely need that infrastructure. I can't believe the tales I hear about people not being able to get through to their GPs, etc. It's to my mind, it's not a service. Absolutely dreadful.
It's very topical at the moment with the numbers of houses that are being required to be built in different areas. I guess that's hitting Castlepoint as hard as everywhere else, is it?
Yes, and we've got particular sympathy for Canvey Island, because the way that comes to a halt whenever there's the slightest impact on the access roads, and the vulnerability of it being in part below sea level, and to land flooding through rainwater, it's just dreadful. And we really think that there should be no additional houses on Canvey Island as part of this. And also, I'm quite pleased to see that our MP has finally come out with saying that it's an unsound local plan. We always said that the idea, which he mentions now as well, that we look at the northwest of the borough, and that means where the A127 and the A130 join, kind of north of Woodside, that should be a full-blown business park and new housing area, and the manor trading estate should be housing. But these are detailed issues. The main thing is recognize it's national policies which hit the local people, and therefore people look, I think, to what's happening nationally rather than to their local leaders.
You say perhaps with the departure of the disgraced former Tory council leader, it heralds a rethink of the local plan. Do you think it's too late for that?
I hope not, because I think Boris Johnson, as our MP, has had a bloody nose in the recent defeat in the by-election West London, where we see people rebelling against their land being taken over, their greenbelt, etc. He stood up in the House of Prime Minister questions time and said, "We are going to, not going to intrude on greenbelt land." But then the reality is he does, and what can you believe that? So I think that there may be that rethink, and the fact that our MP is a whip within the government and is saying that the plan is unsound, surely gives a little bit of hope to those. Because a change of leader, we got a change comments from the MP. We got common sense saying that it's clearly wrong to use greenbelts at the boundaries, which is exactly what greenbelt was about, and farmland such as Jotman's being used without a proper consideration of a plan to take out trading estates from in the middle of housing, and making a good business park in Benfleet up at the northwest of the borough. And the fact that the MP mentions the northwest of the borough, to my mind, is a good pointer. So, as I say in the article, can we hope?
Right. I think the only thing that we haven't spoken about, and we kind of skipped over it, was what happens to the 788,000 people in danger jobs that the TUC's revealed. You're concerned about that. Can you tell me about that, please?
That number there, Mark, of 788,000 who are not included in statutory sick pay at all, and it is an indictment, I think, on how we're treating these people who have served us so well. And the reason why I put it in there is that we don't get that kind of information out in the usual media. Thankfully, the Ireland Times always produces exactly what we put, and this is an attempt to get that information out there. It's unfair. And I think that's what we're about. We're about trying to be a fairer society, but also doing things better. I mean, even going back to housing, even the Tory vice chairman said it would make sense for councils to do what developers are doing. If developers can make a profit out of it, why shouldn't councils do it for their own people? And Labour policies on land is to have a complete land review, so that we aren't having as they call it, a fire sale of land and assets, etc. So developers can make a fortune. We've got to get the right kind of housing, real affordable housing for our people, not just look after the comfortable ones with the paid up mortgages and the like. And of course, as soon as we attempt to get rid of the unfairness of people being bullied out of their houses and the like, and encouraging them to downsize, then we'll free up housing stock as well. So I think a common sense approach based on fairness and listening to people, that's our approach. It says here on council and social homes, more than 1 million households are stuck on council waiting lists. So Labour will invest to build over 1 million genuinely affordable council and housing associations homes over the next 10 years. Within 5 years, we'll be building at least 150,000 of these homes a year, with 100,000 council houses for social rent at the heart of our new programme. And this is kind of, I think, plus the approach to land, which I think is going to kind of changed how things function. We're going in one direction. We need to change the line around, do a complete new turn. It's going to be slow, but we've got to get back going in the direction of providing things for our people and not just making it a developer's paradise. Yeah, when we get all these extra homes, Mark, and people are coming in to buy them, their kids are going to want the house as well. It's not going to change. It's just going to exacerbate the problem in the future. And I don't know about you, but you must be hearing the same as me, people trying to get through to the GP surgeries or whatever. When did we ever accept this? And now we find that the people are effectively having their surgeries bought up by these people. That's to say that in reference to the changes that we hope to make in terms of fairness to the society, we're going to have to change the direction in which things are going, U-turn in a sense, in a slow process, to make sure that we do have proper provision for people, particularly in GP surgeries and the like. I'm sure that everyone's got their experience of trying to get through to GP surgeries and finding that the service is no longer even worthy of the name. And that's not to knock the hard work the people are doing. So that's a big concern for us. But I'm also aware that we're going to have major changes. We're going to be changing from simple GP surgeries with a nurse or whatever to integrated care. And unfortunately, whilst that's a great concept of having all kinds of things, and I'm definitely for this, physio and the rest of it, it's a good rational approach. But some aspects, particularly in social care, are means tested, and our NHS isn't. And you can bet your bottom dollar what's going to be happening in terms of how that thing's going to get mixed, and what becomes means tested and what remains free. I've always been very conscious of the fact that it was the GPs that remained outside of the NHS when it was first formed in 1948.
All right.
And yet, well, yeah, they refused to actually come in. So, as it was put at the time, the the government stuffed their mouths with gold and got them on basically as private, but participating in the NHS.
Mm.
And it's that one part of the NHS that's private that the 2012 Act put the commissioning of new the care commissioning group, the CCGs, it made them responsible for it. So is it any wonder that certain things are dropping off, like for instance, people going elderly going deaf because they no longer get their earwax removed and things like that? All complete false economy to my mind.
All GPs are operating outside of the NHS. They are private
they have
businesses already. Is that the case?
They're private businesses that are contracted to the NHS, and they never were taken in like the hospital doctors were in the hospitals and the other aspects fully into the NHS. They're contracted in, and in fact, my personal belief is that we should go the whole hog and make sure that GP services, primary care as it's called, is all fully part of the NHS. But for the doctor's sake, for the GP's sake, as well as us.
Yeah,
because now they're being bought by Virgin Health and American insurance companies, and they're not doing that for nothing. They're doing that to make a profit. Most of the GPs see their pension and their future based on their surgeries. And so when it comes to a lot of them are going to be past retirement age in the next 5 years. And they see that the idea will be to actually sell their houses because that, or their surgeries, because that's their pension. And ideally, any government in its right mind would buy those up and make sure they continue. But the GPs want that, but it's not happening. There's no plan to try and help those happen. And also, the GPs are finding it difficult to people to come in and be part of their practice because it's better for the doctors to be locums. They don't have the responsibility. They don't have the whole business of actually being partners, and that's a pretty dodgy old message for the future. We got a vulnerable GP with aging GPs and the people being vulnerable to their GP surgery being bought up by American insurance companies and health providers. Very worrying.
That sounds a very good point to wrap it up. Unless there's anything that you feel we haven't touched on that you'd particularly like to talk about, is there anything else you can think of?
Well, absolutely loads, Mark, but I'm going to try and keep it simple. And once again, thank you for your opportunity to get this message out to people.
That's brilliant. It's very nice to have met you and spoken to you, Joe. I look forward to speaking to you again.